Hi, I'm Bev Brock, and like virtually every other person on this earth, I understand only too well the impact that stress and trauma places on our lives. I have great pleasure to introduce to you today Fiona Mawson, who holds a Master's in Psychology, is an EMDR consultant, has established the Kalinda Wellbeing Centre in order to help people overcome these sort of issues, and is an NDIS service provider. So Fiona, you've got a skill set that it's desperately needed in today's society for so many reasons. In order to help everyone understand, can you briefly explain the essential essence and the shared perspectives between healing the hurt and the gathering of kindness?
Yeah, thanks, Bev, and thank you very much for inviting me to come and speak with you and to speak with all of the people who are participating in this what sounds like a wonderful gathering. So I think the essence is that in today's society, it not only takes individuals to share and to be kind to one another, but we also need more systemic and organizational focus on what it means to be kind. And for me, being kind means bringing a human perspective to the people that we interact with on a day-by-day basis. And that also means organisations supporting employees, staff, medical and health professionals and their support staff to actually work from a place of the heart, from a place of kindness that has that ability to balance the conflicting and often competing demands of working in environments that are high stress and often very demanding. In terms of healing the hurt, I mean, our focus really is on ground level, working with communities and working with people so that we can help them to move into and through trauma events which happen on a day-by-day basis for many people in many different sorts of settings and situations.
It's so that's so true, Fiona. Look, I've taken a number of close friends and family through the last weeks or months of their lives, and it became totally obvious that stresses and trauma that have accumulated over their lives for so many people are often left unresolved. This fact is exacerbated when people come from rural, regional and remote areas. So can you give us an explanation from your own experience as a professional practitioner, the impact of unresolved issues that they have on a person's ability to make the most of their lives?
Yeah, great question. Thanks, Bev. From a personal perspective, I was living in Hillsville during the Black Saturday bushfires, and so not only was I a health professional living in Hillsville, but I was also at that time a victim of the Black Saturday bushfires. And today, rather than say victim, I more say survivor. And so from my perspective, at that time, I had to both manage and juggle my own trauma of living through Black Saturday, but I also had to support clients, and because I was managing a health service, I had to also support my staff. So it was a pretty challenging and difficult time for probably the first 12 months. But it's the ongoing unresolved trauma from those sorts of major bushfire events or flood events that led us to develop the Trauma Recovery Network, which is part of Healing the Hurt. And so that's really what drove me, as well as my interest in psychology and the psychology of care for people, the care for their well-being, and as that flows on into the care for their families and their capacity to also care for their communities.
I was only on the fringe of the Black Saturday, but I still feel very strongly the impact of that. So throughout history, treatment modalities in handling these deep-seated traumas and psychological issues have thankfully evolved greatly, improving the possibility of better outcomes. EMDR is a fairly recent, non-traditional type of psychotherapy. It's proving to be an extremely valuable method to use in such areas such as PTSD. Can you explain to us a little about how it came to be and some of the examples of success you've had when you've been using it?
Sure. Thanks, Bev. Eye movement desensitisation and reprocessing is what EMDR stands for. It was developed about 20 years ago by Dr. Francine Shapiro, and she actually came across it through her own observation when she was walking and she was thinking about cancer treatment that she was going through, and she noticed that as she thought about her own trauma, her eyes moved left to right, and she realized that she started to feel a little bit better. And so that actually began a whole that from there developed a whole treatment therapy around eye movements. Now, today we don't actually focus so much on eye movement, we call it bilateral stimulation. And that means that we're actually stimulating the left and the right brain. It's very much a brain science-based therapy, so that we can process trauma memories from one part of the brain, which is usually held close to the amygdala, which is the emotional center of the brain with fight, flight, freeze, submit responses to trauma, to the prefrontal lobe, where the event is a narrative, it's a story. There's actually no emotional content to it. And so EMDR is recognised by the World Health Organization and by Phoenix Australia as a very strong evidence-based treatment for PTSD. And more research is telling us it can be used for depression, anxiety, OCD. There's a whole range of psychological presentations that EMDR is very useful for, but mostly complex PTSD, such as things like people who present with childhood trauma, assaults, any sorts of medical interventions. It's very good for as well. I've often treated children who have medical interventions when they were very young and they're now adults.
Thanks, Fiona. That helps us understand EMDR a lot better. Look, there's no doubt in the past couple of years that Australians have experienced severe traumas through droughts, floods, the pandemic, and the horrendous bushfires. Could you tell us some of your personal experiences regarding the bushfires in these recent times?
Certainly, thanks, Bev. Well, even today, I'm still seeing clients in Healesville who were affected by Black Saturday, but more recently, I've been seeing clients from the East Gippsland fires. And the thing that's really interesting is that the same themes come through, 12 years later. Although perhaps for East Gippsland, that whole theme of Black Saturday, of the miscommunication, has definitely improved. But for people, it's really about the loss of community, the loss of sense of belonging to where they live. And very much so, it's also about, people's security, and their sense of being safe in the world has been fragmented and disjointed, and that's led to families experiencing extreme stress. And then when you add in families that have got children with special needs and can't necessarily access services that a neurotypical family with a neurotypical child has, it's really challenging. It's challenging for people. And, when they're still not in their homes in East Gippsland, as they weren't in Black Saturday for many years, my heart really goes out to the struggles that they face on a day-by-day basis.
So how are these presenting to you? As delayed trauma? Is it secondary trauma?
Well, I think that sometimes it can be delayed trauma. I agree with that. And certainly with some of the Healesville clients that I saw, it was delayed for some people came in 5 years after the event. I think it's cumulative stress, and so it's having to make decisions when people are not in a good, strong frame of mind to be making those decisions. They're still in their fight flight mode. they're still experiencing the physiological sympathetic responses to trauma, and so that means that they're not relaxed. They're not necessarily able to think things through cognitively in a way that they normally would, and they often get conflicting information about what they should do and the decisions that they should make. So it's it's a really it's a difficult time, and I think it's also fair to say that people's resilience will also come through, and I often see great strength in people when they go through these trauma events that really still surprises and amazes me today. And often it's just helping them to resolve the stored memory that's maladaptive, and helping them to connect into their adaptive memories and their strengths and their resilience that provides a really good support base for them to move forward through their healing journey.
I remember standing and watching the fire front on Black Saturday come and hoping that the wind would change direction. And then it's the accumulated, the little things that happen after, not related, that are like the straw that breaks the camel's back. So I understand fully what you're saying.
Yes.
Look, there is that huge need for this type of service and therapy that you're able to provide for people in need. Is there any training available for the public sector, particularly those without a budget who want to establish such a program?
In order to be an EMDR practitioner, you actually do need to be working in the mental health field. You can't actually access the full training for EMDR as a therapist unless you meet that criteria. However, one of the major activities of the Trauma Recovery Network in Australia is to take the critical incident early intervention training, sort of we call them protocols, into the general public. And we're actually hoping to start a program where we can train first responders who can then, when they go into these trauma situations or the extreme situations, they actually themselves have a skill that they can very quickly and very easily provide to survivors or people experiencing these events, so that it's less likely the survivor or the victim will go on to develop PTSD or post-traumatic stress disorder. And that's really exciting for me, to think that it's not going to be psychologists that only have these skills, but a whole range of people. In every hospital, there's a critical incident debriefer. And at the moment, they've been using what we call critical incident debriefing skills. But if we could get these people trained up in how to deliver EMDR type protocols that don't require a mental health background, then we believe the impact that's going to bring to these organisations and these communities is actually going to be really significant.
That is so good to hear, and it's great to know that an organisation such as Rotary, as a community service, can help establish those training facilities and help those first responders cope, because they themselves have the trauma and self-skill. It would be absolutely fantastic. Thank you so much, Fiona, for your information today. I'm quite sure that everybody viewing will take away some very powerful lessons.
Oh, Bev, you're so welcome. I was just so grateful and so excited to be asked.